Hey everybody, I had some people ask questions and said they were a little bit uncomfortable with injecting the DAO, or depressor anguli oris, and they're worried about hitting the DLI. And so I found this beautiful study done by Choi et al. And in this study, Choi basically found that there were really great anatomical landmarks that you could find using some basic anatomical drawings and landmarks to basically find a way to inject the DAO with 100% correlation without ever hitting the DLI. And so one of the things that Choi did is he basically drew a line from the autobasion inferius, which is a fancy way of saying where the ear connects to the jaw. They drew a line from there down to the mid-sagittal plane here in the middle of the face. And basically from there they found these 5 points that were anatomically correlative among all the bodies that they studied to determine if there was actually a way to use anatomical landmarks to get the DAO. And they found that this P5 point here was actually the best point for the DAO, and is basically where the mid-pupillary line lines up here on basically along the line drawn by Choi from the autobasion here to the mid-sagittal plane. The P5 point is the area that has 100% correlation in the study to being where the DAO is without any chance of hitting the DLI. So pretty cool. I went ahead and did a patient with this. The camera angles are a little bit weird on this, so please forgive that. But we just did this today during clinic. And I did the best I could on the editing. It's not perfect, so please forgive the amateur video stuff. But basically, I think it's kind of a useful look. So we did actually have a patient. We did the procedure. We first did the markings just like Choi said, found our P5 and our P4 points. Then we used ultrasound just to confirm them, and they correlated 100% with ultrasound. And we show all that in the video. So if you ever are somebody who wants to do lower face talks and you're a little nervous about getting the DAO right, definitely watch this. I think you'll find it will give you the confidence to do what you need to do and read this cool study. It's really, really nice, and I think they did a great job. So hopefully this is helpful, and I'll talk to you guys later. Talking about how to find the DAO, the depressor anguli oris. As you are aware, the DAO and the DLI are very close to each other, and it's very important that when you're using neuromodulator that you hit the DAO and not the DLI, because you can get some undesired effects. So there's a beautiful study by Choi et al. That actually describes exactly how you can find this without the use of ultrasound, but today we're going to show how to do it without ultrasound using anatomical landmarks as described in the study by Choi, and we're also going to describe how to use ultrasound to find the DAO and the DLI as well. What Choi described was a very clever model, which he uses a line from the mid-sagittal line. So we're going to draw a line here in the mid-sagittal plane here. All right, sorry about that, Jason. And then we're going to draw a line from the autobasion inferius here to this mid-sagittal line. And so I'm just going to draw a line from there to there, so you can see here. And so now you can see there's a line between the two. And what Choi describes in his study is that if you look at the patients from the very front, and you ask, hey JC, do you mind just looking forward here at my finger? From the mid-pupillary line down, so I follow her pupil down, that this right here is what's described by Choi as P5. And that P5 is basically the location of the DAO without any interference from the DLI, and that if you follow the Chilean here, this is actually P4, which is where the DLI is. So just from anatomical landmarks, you can actually identify those. And just to prove this effect, we're going to ask JC to make us some faces here. And sure enough, we see here, great, pull from the DAO. Excellent. And so you can use this anatomical landmark first if you want to. And just remember, it is basically the line here from the autobasion inferius here to the mid-sagittal line. And then you can see here, right where the mid-pupillary line goes down to meet this line here. And that's your P5 point. We're using this GE V-scan ultrasounds. What we're going to do is we're going to take a quick look and identify the DAO, which is more superficial than DAI. Here on ultrasounds. And so here's our ultrasound screen. Hopefully you You guys can see that okay? Sorry, just a little cold here. And you can see here on the ultrasound, here's your epidermis, here's your subcutaneous fat, and you can see the first hypoechoic structure there is actually your DAO. So when we take a look at it, I'm just going to rotate the probe to get a better view. And if I could trouble you, JC, to make that same face with the down, not the small one, the one like, yeah, there we go. And notice here how you see this hypoechoic structure actually increased in size. Relax again. Notice here how it decreased in size. One more time. There we go. And so here's your DAO as identified by ultrasound, and sure enough, we kind of took away some of the markings, but it's right here, this P5 point, as described by Choi. And you can see it again on ultrasound here. And you can actually, as we slide over a little bit, you can see the DLI there. It's the second structure that's beneath the DAO. So you can see the hypoechoic structure there. And you can actually use this as an ultrasound guided injection if you wish, or you can use the anatomical points, your choice. All right, so now we're gonna do the injection. And so we're looking right here, we can ask again, do you mind making the face where you pull down the bottom of the teeth like this? There we go. And sure enough, it's right there. We're always gonna be facing the needle away from the DLI, so face it lateral. We're gonna go underneath our mark here. It's a very superficial muscle as well. So just go ahead and relax. Okay, and that's it. There we go. All right, so now we're going to do the other side using anatomical marks. As you can see here, we've aligned from the oto, basion, and furious here to the mid-sagittal line, following the Choi study's recommendation. We have a line here at the mid-pupillary line, and then we have one here right below the Chilean of the lip. Chilean meaning where the inferior vermilion, where the borders meet for the upper and lower lip. And this is the P4 point here, and this is the P5 point here. The P5 point corresponds to the DAO. The P4 point corresponds to the medial border of the DAO, but also the beginning of the DLI. So it is recommended by Choi that you go to the P5 point, as the P5 has 100% correlation with DAO in the study. So let's see if we can get this guy. Hopefully the brightness is good enough. So as you can see here, let's see if I can zoom in on this. You can see here's the skin. So here's epidermis, subcutaneous fat, and then you see a very large hypoechoic structure right here. Notice here on the ultrasound, I'm at my P5 point. The center of the ultrasound point is at the P5. You can see there. You see the middle mark, P5. And sure enough, Choi is right here showing the body of the DAO right there on ultrasounds. And just to confirm, JC, could you make that grimace at the bottom again like this? All right. So, sorry, one more time there. Kind of move my probe. And you notice there the, one more time on the grimace sticks. Perfect. Notice here how it strengthened and relaxed. Notice here how it went down. So there's your DAO. If you side on over, you can see the DLI lower, and there's the beginning of the DLI here. And so we definitely don't want to hit that one. We want to stay superficial and go to the DAO. And notice here the DAO is more superficial, the first hypoechoic structure. So here we have the P5 point, a little bit washed off from the ultrasound gel, but you can see here, and when JC does that, I can feel the muscle. Relax, JC. Okay, and one more time, make that, yeah, there you go. And feel the muscle move itself, very superficial. So we will clean that off and then do a quick injection. We typically do 2 to 5 minutes for Botox or Xeomin, and then 3 times that for Dysport. Okay. Probably for this one, I might cross the bed real quick here. There we go. All right. If you don't mind, make the face one more time. Great. Okay, relax. Perfect. Okay, superficial. That's it.